Here's another therapy technique that works for some people's backs. It works tremendous for my back. 35 years ago, I'm in chiropractic college graduate school, and this therapy called Flexion distraction was used on my back. And oh, I saw the light. It was an awesome experience. So I thought, I need to be doing this for my patients. Now, Flexion distraction does not work for everybody. There are some people's back condition where it actually gets worse if you do this therapy. You're going to see it how in a moment we are opening up, we are distracting the lower back discs and joints. If you look at us under gravity, gravity compresses down on us all day long, compresses down on the discs and the joints, and if they bulge and you get inflammation and bone spurs and arthritis and so forth, eventually that can cause pressure on nerves and cause then leg problems and so forth, okay? So the goal would be, if here we are standing and our spine is compressed, is if we can turn it and open it up like this gently, then that's going to work. For some people, this is a better scenario than inversion, which is hanging you more upside down. So here we are compressed. Inversion, upside down or at least at an angle, can be good for some people, not everyone. Again, some people's back problems are made worse by inversion, and some people are fantastic. Mine works very well with inversion. But putting it horizontal and then gently opening up can really help someone's lower back. It's disc hydration, it's disc motion, it's joint motion in a way that you can't do with exercise. So looking at this video here, you're going to see I'm on this flexion distraction table. The upper part of the table is stationary. The lower part, in this case, this is a motorized version of the table. There are manual versions, but this is a motorized version of the table. You'll see the lower part of the table dropping towards the floor. Okay? So my legs are dropping towards the floor and I'm bending around the belt line. And that table is opening up the disc and joint spaces gently, but nicely, and this can really work well for some people. I have some patients that eventually, when we get them onto the table, because we've gone through our contraindications and I do some other chiropractic work, and I'm like, you know, you're a candidate to try this table, let's go give it a shot. And usually in 1 or 2 pulses or 1 or 2 bendings of that table, 1 or 2 repetitions, if you will, we pretty much know. Somebody will say, yeah, I mean, I can even take the table down and stop, and then I'll ask the person, how does that feel? And if they say, okay, or if they say, ooh, that feels good, boom, I know that they're probably a candidate, and then we'll put them on there for 30 seconds, a minute, whatever it might be. Most people on that flexion table that you're watching do really well in about 2 minutes. Most people are pretty good in 2 minutes, and that's about what they need. Some people 3, maybe a little bit longer in a few, but you can see the motion that you're getting in that spine, okay? A good example I like, and oh, by the way, here's the second video. So you know that I also have a low-level laser, and I've done many videos on low-level laser therapy. I've had lasers in my office for 17 years plus. Here's a video of me on the flexion table doing the flexion distraction mechanical work, and then I'm adding the laser to the lower back at the same time. Now, laser can penetrate clothing. It's not as good as having it on the skin, but you can see here I'm doing it over my clothing, and so I'm adding the 2 therapies at the same time. Pretty cool. So laser is adding laser photons, laser energy, laser photons to the cells, so the cells can create energy and do whatever that cell needs to do. So if we're trying to produce new tendon cells or muscle cells or cartilage cells or ligament cells, those cells are going to work better with that added energy. That's how lasers work. Lasers are going to increase blood flow. It's going to increase all the things, the cellular activities that we're looking for. So now we're getting the mechanical activity of the flexion distraction table on the discs and joints, adding the laser energy to the cells. I mean, that's a pretty good double whopper there, if you will, as we're adding that in there, okay? So I've figured out with some people, when they do the flexion table, for some, they get off the table and there's relief right then and there. And they will actually continue coming to work on that disc problem. So for some people that have acute low back pain, they're coming in like this and they kind of can't move, 9 times out of 10, 49 times out of 50, I'm not putting them on that flexion distraction table. That will be bad. And I've learned my lesson there. For a lot of people with more of a chronic problem like mine, I put them on the table and stretch them out, and if they're a candidate for that and it starts working, it usually works really well. And keep in mind, of course, we often do the flexion distraction table by itself. We also can do the laser therapy by itself, but there's a couple of different ways that I work on myself and other things that you can research for yourself. If you're not in my area, you can contact chiropractors in your area. Some physical therapists probably have similar things like this as well. So ask around and see if this is something that might benefit you. I'm Dr. Scott Fuller.